This session, Connecting for Care, How to Organize Support in the Complex World of FOP Care Management, is one that I've been looking forward to. We're going to be hearing from 3 different panelists today. Our first presenter is Laura Theoret. Laura is the mother of a young boy with FOP. Laura spoke first on this topic during our advocacy series community panel that was held on the topic of navigating and supporting in your team in the medical setting. So in Laura's talk, she shares about care maps and how that resource has been a valuable asset for her family and how it has led them to receive care and additional support through the complex care medical team at her local university or her local hospital. So I will turn it over now to Laura's pre-recorded talk so that we can all learn from her family's experience.
Okay. So I learned about care maps from a friend that I met through a Facebook group for local parents of kids with a physical disability. We both had children with ultra rare diseases and became friends through attending various rare disease events in our city. She had shared the article about where she learned about care maps and shared what a powerful tool she found it was to be advocating for her daughter. And I'm just going to digress a little here and say, you know, I've learned so much about advocacy through networking with other parents whose children have a rare disease or a physical disability. The FOP groups on Facebook are an amazing example of the support you can receive and learning tool. But I encourage everyone to network beyond that. Your local disability networks can provide information and guidance on how to navigate transportation, schooling, funding, tax breaks, all the things specific to your area or region. So I highly recommend reaching out and seeing what else is out there, because that's how I found this tool. And so how do you make a care map? Basically, I just need to start it. There we go. You start by putting yourself in the center of the map and your immediate family. From there, you need to think about all the key domains of support and care, such as medical or health, home care, community, support, school or education, work, housing, transportation, social services, leisure, social or recreation, behavioral or development therapies, advocacy, spiritual or religious, and your friends or family. You know, you don't have to put all these on there, but these are the categories that you want to think about when starting. It's up to you what you put on your care map. You may even want to combine some things together. Your care map can be simple, like my original care map that was scratched out on paper, or you can make it fancy with color coding and symbols. Your care map should be treated as a living document that can be modified to reflect changes in your care and support as they evolve over the years. And the neat thing about doing this exercise is, you know, when I first sketched out this map, I mean, I've added a few things. Not all those bubbles were there initially, but when I first sketched it out and I looked at it, I was just shocked at the complexity of our lives. And, you know, I thought, geez, no wonder I feel overwhelmed so much. You know, there's just really a lot to coordinate. This is my son Jackson's current care map. At the center, we still have Jackson and the family. Jackson's 12, so the largest domains of care for him are really home, school, and medical. But you know, these domains will change over time as he gets older. We're gonna, when he moves on to university, you know, we'll probably have to add some housing stuff later in life. You know, work will replace school as the most important domain of interaction. It got really complicated. Like I don't know if you know the last one, you know, there were sort of lines everywhere. So to try and like cut down on the visual clutter, I kind of grouped in a box each domain and then didn't use lines. I just used the lines to show where the domains interacted with each other versus directly with Jackson. For example, the OCTC recreational therapist consulted with the school to help provide ideas for gym. They brought in like curling done on wheels that they could do in the gym, things like that, different ideas. So that just sort of cuts down on the clutter a bit. I use square text boxes to represent an individual, like a doctor or a therapist, and I used the rounded text boxes to represent organizations such as the IFOPA or a vendor, different things like that. And really, you can be as creative as you want, right? It can be simple, it can be fancy. It's your tool, make it work for you. And then using the care map to advocate, I found it to be a great tool in advocating both in the medical and school setting. It gives the medical care providers and school staff perspective on the complexity of his life and the challenges that this brings. Adding another therapy or catching up on all the schoolwork missed due to an appointment may not seem so reasonable when you have them look at this big picture of what's really going on in his life. It also helps us as a family keep sight of our own priorities when we're having these discussions with the providers. Because I think it's very easy when living with a rare disease to get caught up in your health. And we want the focus to be on living life. Let's get out there and live life to the most. It also can open up doors to more support through programs such as the Complex Care Program at our local children's hospital. It was a program created to better support families like ours that have many medical professionals' care to coordinate. In the program, there's a pediatrician and a nurse assigned to each child. The nurse helps coordinate care to reduce trips to the hospital and improve communication between all the medical professionals. The doctor oversees the big picture of the child's medical care and health. And this program has provided us with so much support over the last few years. We have a document on file at the hospital, and we carry a physical copy with us at all times that flags the challenges and risks in treating Jackson specifically, captures where his restrictions are, etc. This document alone has been pure gold. When we arrive in the ER, we're given a separate waiting area or room to reduce our virus exposure risk. The imaging technicians are far more receptive to my input on the positioning and support needed during x-rays. And if something more complicated arises, they can page the complex care doctor for assistance. The complex care team also advocates with other departments in the hospital on his behalf. And we've particularly benefited from that recently with all the delays in care with COVID. After I communicated concern early in the pandemic about how long it had been since he'd had a dental appointment, lo and behold, dental clinic calls the next week. We'd like to book you in. Similarly, recently, I was complaining about multi-one-year delays in investigating an issue that everyone keeps saying, it's nothing, but let's just check. And then it's like a year to get that test and a year to see that doctor. And it's been going on for 2 years now. Well, a couple of weeks later, I get a call. Oh, there's been a cancellation in the MRI. Do you want to come in? So these are the benefits of using the complex care program has provided to us. And that incredible program may never have been offered to us at all if I had not so clearly demonstrated the complexity of our lives with the care map. Not all children's hospitals have a complex care program, but it is a program that is spreading. So I encourage you to reach out to your local hospital and inquire whether that is an option for those of you with children who are here today. Care maps can also identify gaps in care or help them help you better understand what's going on medically. So I highly recommend giving a care map a try.
Thank you to Laura, who couldn't be here today, for serving as such a wonderful example to help our others feel empowered in their role. I know just listening to her, I feel inspired and ready to take action. So thank you, Laura. And And as you've seen from Laura's talk, or if you were able to join our previous session with the ear, nose, throat experts from the Netherlands, our families oftentimes need a large team of specialists for support. So here to share more about complex care, the hospital program that Laura mentioned, and to talk about some of the principles of complex care that can be accessible for everyone, regardless of whether or not you have access to a complex care department, is Amelia Alberger. So Amelia is a social work care manager at Cincinnati Children's Hospital Medical Center in their complex care clinic. And I am going to turn it over to you now, Amelia.
Thank you, Hope. Yeah, Laura's presentation was just a perfect segue into about what I'm going to present here. Like Hope said, I am a social work care manager in our complex care clinic. And just kind of in a nutshell, I have a caseload of our patients who come to complex care who, in addition to when our patients come to complex care, it's just a given that they have a lot of medical complexity. But in addition, something else that creates a lot more barriers is when they have a lot of social determinants of health as well. And so that's when our social work care managers come in and sometimes have the patient on our caseload individually, or we actually pair in with a nurse care manager or a nurse coordinator to kind of like tackle everything together. So I'm going to talk about that a little bit during my presentation here. So first and foremost, before I'm a social work, where did we go here? Oh gosh, my pictures left me, Hope. Can you guys still hear me?
Amelia, you're doing great. You can just advance to the next slide.
Okay, you know what? Something got deleted here, but that's okay. It's just the pictures of my really sweet daughter. So before being a care manager, I am actually the mother of a daughter with special needs. My daughter was born at 23 weeks gestation, and we still don't know all of the circumstances around that, but you can only imagine that when you do have a child who's born that early, there are just naturally going to be a lot of medical complexity and things to work out, therapies, just pretty much throughout her life. She is 13 now, and she's doing fantastic. She ambulates in a wheelchair, and she uses a speaking device to talk. And she is just the love of our lives, and we just feel very blessed to have been a part of this journey. And I am so sorry, you guys, I'm just going to improvise here because I don't know where I've lost some slides here. So just to kind of give you just the beginning of taking off from what Laura said about what complex care does, we are a team of professionals. We have providers in the clinic. In our clinic in complex care in Cincinnati, we have 5 medical doctors and 2 nurse practitioners. All of them are assigned one of, I believe we're up to about like maybe 630 patients in our clinic right now. And in addition to that, we have a team on the team. We have social work care managers. We have a clinic social worker. The clinic social worker actually goes into all well checks and chronic care management visits. It's kind of like a way of having 2 well checks per year. We actually see our patients twice a year. We have registered dietitians, nurse care managers, the clinic social work or the clinic nursing staff, and we also have a pharmacist. The pharmacist is really a cool addition that we have because the pharmacist actually goes through the med list with all of our families at the beginning in their new visits and just kind of cleans them up. I don't know if you guys ever go and you have to like talk about your medications and you're like, oh my gosh, four visits ago, I told you my child wasn't on that medication anymore, and you're still asking me about that. So our pharmacist just kind of cleans up that list and keeps it nice and tidy, and is really helpful. There's so many medications that are just a pain to get because you can't, insurance won't cover them, or they need denials for 3 other medications before they're going to pay for this one that's being prescribed at this time. And it's just really amazing, just kind of the connections that pharmacist has to get the patient what they need at that time. Because as a care manager who's overseeing patients and the mother of a child with medical complexities, nobody has time to wait for things to get denied. We need this stuff now. So our clinic just works really hard to make that happen. So the slide before this that I don't have there anymore, and I apologize, it just gave kind of like the specifications of what it would be to actually come to our clinic. So we start to see children from birth, and we actually keep them up to age 25. So we just, you can only imagine just how we just go through the whole process and what's involved there. They come to us when they're young, and then we do things like, okay, when you're 3 years old, it's time for you to be able to go to preschool because of the medical complexity with you. And we help them through that, which is a big hump, because you're getting kids ready for school through their IEPs and the school forms and the nursing orders. And does this patient actually need a one-on-one nurse? And there's actually kind of a lot of fighting with schools, to be honest with you, because we know that those supports are very expensive. And schools like to have their stipulations of what's going to, what our patients need in the school setting. So as a social work care manager, that's probably 50% of what I do. Is I am in these IEP meetings advocating for these patients, just helping them get what they need, letters of medical necessity. And I know I'm preaching to the choir. I know that this is just stuff that you guys I'm sure are just dealing with and working through all the time. It becomes a lot, but I'll tell you, I love it. I love advocating for my patients. I love my job. It's funny because we were talking last week in our clinic just about some people who are just kind of ready, and they're counting down the days to their retirement. And I'm literally not doing that. I've been a social worker for 28 years, and they're going to have to carry me out of there. I just don't even see me ever leaving the clinic. These are my people. So to kind of catch up with the slides here, something that it's very stressful in our clinic is we basically track our patients' progress as they hit different times of their life, starting with guidance with guardianship if it's needed. Many of our patients have a lot of cognitive disabilities as well, and are not really going to be able to navigate their medical care or their finances or anything like that. So we actually start talking about transition in our clinic at age 12, even though we're keeping you till 25. And the reason for that is because when you have been with complex care and you have all of these relationships and you've had those for the past 12 years, it's very scary for parents to want to transition into adult care. And we get a lot of pushback for that, very understandably. So it really takes us the next 13 years to help patients feel comfortable, and we start looking at specialists in the adult arena and that sort of thing, and that can just take a really long time. At 16, I start talking about the actual guardianship process, and we start, does the child or the patient need an evaluation, or is it just something that the doctor is just comfortable in hearing the concerns of the parent, and also just agreeing that the child is going to need legal guardianship as they grow. So another thing that we do in complex care is we answer questions about the patient's diagnosis, their treatment. We provide supportive services. We give recommendations or make referrals around their behavior management needs. Many of our patients with a lot of cognitive disabilities, they have a lot of sensory problems, just things that they're just going to need other support. Sometimes we refer out to help with those things. We actually, just from listening to other parents and just with our experienced team, can just actually kind of give some recommendations and things to try. The nutrition piece is extremely important. Our registered dietitians, they're a huge part of the team, and we all kind of huddle before visits, sometimes weeks before visits when we're planning for a patient that's really complex. Our dietitians look at the labs with the provider and what is this patient missing that could make them healthier and just achieve the optimum health that they can. So they are very big part of the piece here. We help with just parenting and family issues. We have kids who are, so medically complex, and the parent's attention just really has to go to that patient. And parents will just come into our clinic and basically just have a safe place where they can just let it out, and frustration, and there's guilt of feeling like they can't give their other children what they need because of what's going on with the patient at hand. So we just find ourselves a lot just offering that support and validating feelings and offering resources. And if you've had a meltdown in the clinic with us, I'm going to call you in a couple days and check in on you and make sure that you're okay. We have a really close-knit relationship with our families and with our patients. And I don't think there's anybody in our clinic that just doesn't love what they do. Navigating insurance and things with schools, workplaces. We do a lot of family medical leave forms for families, which can be difficult. Like I said earlier, the school forms, I think somebody said we had 40,000 pieces of paper go back and forth between schools in 1 year or something like that. So I already talked about supporting patients and families. So the care coordination with the care team is something that's a big piece of what we do in complex care. If anyone on the healthcare team has questions or just issues that they want to really hammer out to help the patient have a better quality of life, they're going to get with the care manager to kind of start that process. Sometimes we have what's called a care conference where you can bring other professionals together. All the specialists together, so we can talk about the child as a whole and the issues, and other specialists can hear what others are doing and are thinking, because sometimes all specialists can just be throwing this is what's important right now for my specialties side. But when you sit back, like me as a care manager, I'm like, oh gosh, that's a lot. They can't do all of this because GI wants them to, and pulmonary and pediatric rehab, and kind of stepping in and helping let's streamline. What's the most important to you right now, mom and dad, or even the patient, if the patient is able to help advocate in that way. So a lot of it is helping coordinate clinical appointments as well. These families have so many appointments. I just know how many my daughter has, and just how overwhelming it can be. And I'm a care manager myself, and I'll be honest, my daughter does have care gaps. We just can't get it all in. So I use her care manager to help me navigate what's the most important thing. What is it that we need to do at this time to move forward and kind of prioritize. So I know Laura talked about complex care and just the information that I have given you. Complex care, I had met with our director before I gave this presentation, and it looks like the most recent numbers is there's about 119 complex care centers or clinics. And in the chart that he showed me, it looks like there's about 110 or so throughout the United States, and the other 9 were in Canada, and one was actually in Ireland. And I know that those medical directors just kind of stay in touch with each other so they can just like what's new on the horizon, something new that you might have been doing in clinic that's going to benefit other complex care clinics and that sort of thing. But if you don't have a complex care clinic, that's okay. Yes, they're on the rise and that's amazing. But as a parent or a patient yourself, there are so many things that you can do that you can replicate. One is you can find a social worker among your specialists. So think of all of the specialists you see. If you take the care map that Laura talked about, pulmonary, most of them have social workers, GI, rehab. You can always just try to connect with a social worker who you can just kind of get to know and be counted on for resources. I have parents who call me periodically just out of the clear blue, just to kind of keep that relationship. And when something comes up on my mind, they're in my brain and I think, oh gosh, I should call so-and-so. This is something that she might be interested in. So I know they keep themselves like on my forefront intentionally. And that is amazing. That's great advocating. You can also inquire if there are opportunities for care management within your institution. So not all institutions will have social work care managers, but they're more likely to have an RN care manager. So if that's something that you're interested in, it's an option in the hospital or the medical facility where you receive care. That's something that's really good to even just ask your primary care physician about and get connected with. Most institutions have some sort of family financial advocates. That's what we call them at Children's. They could be called something else. Everybody wants to get paid. So somebody there is going to be there ready to help your family with different plans you might not know about, different waivers that you might not know about. There's medical waivers that are all over. I know them by like the back of my hand in Ohio, but I don't know them in other states. So talking with family financial advocates just to make sure that you're not missing something that's going to help with this really, really expensive care for your child or patient. Like Laura said, yes, join social media groups. Not even just in the diagnosis of what your loved one is experiencing, but even ones outside of that. I'm going to give you resource link at the end of this and talk with you a little bit more about that in just a minute. Internet searches for resources in your area, looking for grants, anything that your loved one, your patient could qualify for that's going to help with help their life have a better quality, as well as cover some of the financial component of it. Really make time for social involvement. Sometimes we get so wrapped up in the medical piece of it that we forget that it's really important to be social. Like my daughter plays Miracle League baseball, where she hits a baseball and a buddy runs her to the bases and she just has a blast doing that. She's also on a dance team called Wonders on Wheels. And it's just a really cool way for them to just be involved and have a social impact in their community. Call the care conference. When I say care conference, that's what we call it here at Cincinnati Children's Hospital. And that's where there's just something that's really pressing. Maybe there's a big surgery coming up and you need all the specialists to weigh in on it. You want to make sure that this big surgery that you're being told is needed by one specialty isn't going to affect, make something worse, your child's lungs, your child's heart. It's just a way to request to bring those specialists to the table with you to talk about these things. You can, I just encourage people to inquire about resources and keep a list. Any new resources you hear of, the ones I'm going to give you today, make a list, keep a list of them. It's just something amazing to refer to because it's kind of like when you need it, you need it. Something that you can do even without a care manager is combining procedures whenever you can. Even before my daughter had a care manager, if she was going to be sedated for an endoscopy, I sent a MyChart message to all of the specialists. Okay, Addie's going under anesthesia on such and such date. put in your lab orders. I want to put in your lab orders. Is there anything else you want done? Do you want something else that's intrusive that can be done while she's under anesthesia? Because of course we don't want to just put our kids under too much. And these kiddos, they go to the hospital and they get stuck for blood draws and tests and everything so much that if my daughter can be under anesthesia and have lab work done while she's under from other specialties, I want to spare her from having to go and just get poked an extra time. How am I doing on time, Hope?
You're sorry, my microphone cut you. You are doing great, Amelia.
Okay, perfect, because I promise I'm almost done here. So I made just kind of a list here of helpful resources. And I sent this list to Hope that she can email out to all of you if you're interested in it. A lot of these places I haven't even called or looked into. The first one at the top are some Facebook groups that I am in that have been very helpful. One is just called Special Needs Swap Meet. Another is Kids Special Needs Equipment. And then the third one is Special Needs Gently Used Equipment. I was so glad when somebody told me about these groups when my daughter was maybe about 4 years old. My husband is a mailman and I'm a social worker, and we're just living the dream. And apparently we look really good on paper, so we don't qualify for, SSI or Medicaid, things like that individually. And the only way that my daughter was going to get Medicaid to help pay for some of her care was through a waiver. I knew from being a social worker to get her on that list early, and it took 7 years. And she now has a waiver that gives her Medicaid. And basically, we have a savings account now. She got that about 4 years ago. So, but the importance of these Facebook groups was when, we have really good insurance, but when you have a $4,000 gait trainer that your child really needs, but you have to pay 25% of it through your insurance, that's $1,000. And when you're doing that, 15 times a year for equipment and that sort of thing, it just really adds up. And it just was a hardship for my husband and I. We made it work. We figured it out. But these Facebook groups are like when my daughter outgrows her gait trainer, I actually list it on here and ask anybody if they want it. And people take them. They want, this is how I got her equipment at a time when we were not able to really afford everything that she needed. Is we swapped with other kiddos who had outgrown their gait trainers and their wheelchairs and just, different things like that has been very helpful. The rest of the resources on here are just links to I know everybody's probably heard of Make-A-Wish. These are kind of like Make-A-Wishes, I guess. There's a lot of organizations out there that you would not believe that you might qualify for. So I encourage people just to kind of look at what you need and look at these resources and see if it's something that would be able to fund what you're looking for. For instance, I added one on here, Chive Charities, right here. One of the biggest needs in our clinic is transportation. When your child is, in a position that they absolutely have to ride in their wheelchair, they're going to need some sort of wheelchair accessible van. Chive Charities, that is one of the things that they will do is you can apply for one of those and see if you would qualify for that. We actually have 2 patients in clinic who actually were able to get wheelchair accessible vans through Chive Charities. I didn't even know about it. I stumbled on it. And then that's when we just started kind of talking about it and offering it to patients. I'm told it's a really long process. It takes months. They're going to have you send financial stuff, things back and forth. But heck, that's worth it if for these patients that, wanted to take their children other places besides just to the doctor. Of course, their Medicaid transportation will pay for a Medicaid appointment to be transported to, but their lives should be so much more about just their medical appointments. They wanted a way to take them to the mall and to the park and into the community and just out to relatives' homes and things like that. And they were really just stranded home unless they were leaving to go to a medical appointment. And that's probably one of our biggest barriers is transportation with a lot of our patients, because those vans are not cheap. The second one at the bottom here, the adult organizations for 18 and over. I'm sure there are more than this, and if anybody has any ones that they want to share with me, I would so appreciate that. But I feel like a lot of the resources are for our kids like 12 and under, or younger kids. But the children the patients that I serve in complex care, this is lifelong stuff, and just trying to help them have opportunities to prepare, just to have what they need in their lives. And the reason why I wanted to share these resources, as I have shared with our patients, is just because, as we talked about, things are really expensive. As the patient gets older, they need ramps to access their home safely. Mom can't carry you in the bathroom anymore. You're just too heavy for that. So there's a need to modify your bathroom to make it, more accessible for safe bathing. Vehicle modifications. We have some waivers here in our town that they will modify your van to help you make it accessible for the child if possible. Something we're going through right now is my daughter. We bought this house for our daughter because it's completely accessible, except for there are 3 steps that she needs to go up to get in the garage. So we have a vertical platform lift that is out there. We actually got that donated through one of those special needs swap meets of somebody who was getting rid of one that I shared with earlier, a Facebook group. And now that lift we've had it for about 6 years, and it's just died. It's so old, there's no parts that can be made for it anymore. But thank goodness we do have a waiver now. So her waiver is paying to put one in the garage. So we're actually waiting on that. Other things that you might need resources for is to widen hallways and doorways, trying to get wheelchairs to be able to navigate the home. Incontinence supplies. My daughter is 13 and she's always going to have the need for incontinence supplies. I get mad at my friends who gripe that their 2-year-old, I got to get her potty trained because these diapers are just the national debt. And I'm thinking, gosh, just be glad that you're going to be done at 2 or 3 with those diapers. Communication devices. A lot of insurance companies, they will not cover anything with communication. So the resources that I gave you, that's an opportunity to just see if you can get something like that funded. Any equipment not funded by insurance. Caregivers. Our daughter, she has a G-tube and she uses a wheelchair and the communication device. So it's not like she can just get dropped off by a school bus at the end of the day and wait till my husband and I get home in an hour and a half. She's got to have somebody with her who's trained in her care all the time. And that's very expensive. We've had the same provider for our daughter for almost 10 years now. We actually hired her when our daughter was in preschool. And we just paid her out of pocket, and she had been our babysitter this whole time. And it was actually, it was like making 2 house payments. You've got to, you're gonna have to pay for that. So when she got a waiver 4 years ago, we were absolutely thrilled to get our provider certified. So now she bills the waiver. So it took a long time to get to those points. And of course, I'm talking about things that are in Ohio, but I know that there are these opportunities in other states as well. You just have to know where to go to find them. And if you don't, that's why I say latch on to a social worker. And that's all I got for you.
Thank you so much, Amelia. I think your last statement, latch on to a social worker, is great advice. There are, as you've highlighted, sort of an endless list of to-do things for our families. So I would say that the more you can allocate some of those things to other people, the better. And a lot of our families, from my understanding, are not necessarily working closely with the social worker. I think that's because, sometimes you're not being hospitalized for extended periods and you kind of tend to fall in that gap of receiving those social work services. So I think that Amelia's recommendation of reaching out to your specialist, getting connected to a social worker, and really finding someone who can help share some of the responsibilities is great, because there are some responsibilities that really have to stay with you, right? So that's kind of what our third panelist is joining me to speak about. Carly Flumer is the Director of Medical Engagement at MMG, and in her spare time, she looks to advocate for patients through education, research, and health literacy. So Carly is going to join me on screen, and we are going to have a discussion about health literacy. But Carly, can you start just by kind of introducing yourself and sharing a little bit about how you became involved in this area?
Sure. Hi, everyone. Thank you so much for having me. So I am a stage 1 metastatic refractory thyroid cancer survivor. Those metastatic refractory, those two terms mean that the cancer spread outside of the organ that it was in, which was the thyroid in your neck. And refractory means it did not respond to treatment. So I was diagnosed when I was 27 in 2017. And then I learned that it was refractory, that it didn't respond to the treatment in 2021, so last year. So I have had multiple surgeries and radiation and for treatment. And when I was going through treatment, I was in graduate school, and I was going to school for health communication. And so, because I was going through cancer at the same time, I was really able to kind of use my skills that I was learning in the classroom to apply to my own cancer journey, to create my own story, and to share that. And that's how I got started in patient advocacy.
Awesome. Thank you, Carly, for, I know that that journey was not a fun one, and that you probably wish you didn't have those experiences, but it brought you to where you are today. And I know you've done so much good. Carly's been featured in different blogs and podcasts that she's taken part in. So she has already done a huge amount to help empower people in their own patient advocacy journey. So we are, though, kind of focusing today a little bit more on health literacy. So could you help by giving us sort of a little definition of what health literacy is, and why is it important for families who have a loved one or for individuals who have a rare disease?
Sure. So there's an official definition that I don't know off the top of my head that's defined by Healthy People 2030, I believe, is the next Healthy People thing that's coming out. But it's really, health literacy is really making sure that you understand everything in your medical record, um, to an extent that you're able to act on it for the betterment of your health. So, for example, if you have lab results, that you're able to read them. If you have a scan with like an ultrasound or a CT or an MRI, that you're able to read the results and make sense of them, different things like that. Uh, Looking at a prescription bottle and knowing how to take your prescriptions correctly. All of that encompasses health literacy, and it's so important to cancer patients like myself and patients with rare diseases too.
Yeah. And there's different types of health literacy, right? So just anyone who's seeing a doctor, whether you have a diagnosis or not, it's good to be familiar with health literacy. But there's also health insurance literacy, which I think for our community, anyone who's needing durable medical equipment or special medications, and especially the FOP community, we're sort of advancing and hoping to be in a space where there is a possible drug or treatment for FOP. So health insurance literacy is another part that is just really important. And one thing that I wanted to kind of call out here, because I know a lot of our community members kind of already view themselves as the experts on FOP. With any rare disease, you kind of take on that ownership a lot of times, that you have to be the one who knows everything and is aware of your disease to educate your medical professional. So, that's something that I think a lot of us already are kind of in tune with. but that it's still important to focus on those other aspects of health literacy, like health insurance literacy.
Yeah, absolutely. You health insurance is it's so complicated. It's so needed, but it's so complicated. And I think health insurance companies are starting to do a better job in like providing like a list of what terms mean. But even so, like it's still very complex. Um, but I would say the three terms that you would need to know are copay, deductible, and premium, and also explanation of benefits. Those are my top ones that you would need to know as the basics of health insurance.
Great. Thank you, Carly. Fun things to look forward to after today's session, right?
Yeah.
Go and make sure you know your insurance policies, premium, deductible, list of benefits, all of that fun stuff. So that's kind of a good point. If someone was, listening to our conversation today and was like, okay, maybe this is an area I should start focusing in. How can they kind of gauge or just get a basic understanding of where they are in their individual level of health literacy?
Well, I think that there are quizzes online to determine your health literacy. I'm not sure how accurate those are. But really, I think the statistic is the average health literacy is at between grades 6 and 8. And so it's like elementary to middle school, right? And so, but we're talking to patients sometimes at a very complex level, like they're our colleagues. And so, um, it's important to know where you are. So, if you're having trouble understanding how to take your medication based on the instructions, um, that might be an indicator of your level of health literacy. Um, but you know what? There are also different methods to uh, different ways to learn too, right? So we have to take that into consideration. Are we more visual learners? Are we more um, do it ourselves learners where somebody shows us how to do it? Are we more hearing learners? So you also have to take that into consideration when you're defining your level because we all learn at different in different ways. And so asking a physician to explain it a different way, drawing a picture, writing instructions out in a different way. There's no shame in any of that. We all learn differently, and it's your health, and it's that's another way you can advocate for yourself.
Yeah. And we talked about that relationship with the physician, even also being a good marker for understanding where you are sort of in your health literacy journey. So thinking about, how long have you been with your doctor? And do you have sort of that working relationship that they're able to understand where you're coming from when you ask questions? What good is the bedside manner? In the advocacy series community panel that Laura spoke in earlier, we had another parent who spoke about how that sort of just relationship, the bedside manner with her son who has special needs and their doctor was not congruent, and it was a huge issue in care. So kind of evaluating the bedside manner of your physician, how long you've been with them, and then Carly, this is what you sort of touched on. Just are you benefiting, making sense, and able to care for yourself based on your relationship, the information you're getting from your doctor? Because if there's not a treatment or a drug that you can take, it is sort of how do you feel like you're able to manage your care in the day-to-day scope. So you mentioned some great resources in how to improve or strengthen our health literacy. You talked about seeking out different ways of learning. Are there any other recommendations you would give people on how they can improve or strengthen their health literacy?
I think it goes back to what you were saying about having a good relationship with your provider. Because, uh, I think for patients with rare diseases, it can take many years to get a correct diagnosis, like, or you're getting constantly misdiagnosed. And so, um, I don't think every provider is expected to know everything about every rare disease. But the doctor, and there may not be a doctor who specializes um, in this that you can find in your area. So but the one that you have the best relationship with, where you're able to talk to them freely and openly and ask questions in a reasonable amount of time, because we all know doctors are short on time. That's another thing. Bring in a list of questions that you would like to ask your doctor during that appointment. But having that relationship with that specific doctor is so important, because they're gonna be the ones who are taking care of you, and if your values don't align with what they're saying to you, you're not stuck with that doctor. You can find another one, and it may be really difficult, but I know that there are resources to help with that. So it all starts with a relationship with your doctor, because if you're if you feel like you can ask questions and not feel quote unquote dumb about it, or they don't make you feel like um, you're being stupid or anything like that. Not that I think a doctor would do that, but um, you know, uh, what Hope talked about too is bedside manner. Not all doctors are going to be warm and fuzzy. Some are very firm, and it depends on what you feel the most comfortable with. And so you kind of have to assess that as well, when you're determining this relationship with your doctor. But the more comfortable you feel with them, the more you're able to ask the questions that you need to ask, that are important to you, right? Because it's not it's not all about the medical, right? It's about the emotional and the mental experience that you're going into, and not all doctors have empathy. That's another thing to look for, you know. So it all starts with a relationship with your doctor. And if you're able to ask those questions that you need to ask, or, when results come back, are you able to assess or understand the lab results, or the screening results together, or do they just tell you the results and that's it? So that's another way to assess your health literacy, is your relationship with your doctor, because it can really hinder or hurt if you feel like you can't go to your doctor with a question.
Yeah. And I think our society has sort of this antiquated historical belief that doctors, this is the white coat syndrome, or they're the end all be all of knowledge. And that's not always true. You can fire your doctor. You can have that say in sort of shifting the relationship. So it is still very much in the individual's control. And we were talking about, though, the patient's responsibility in being prepared when they are interacting with their doctors. And you made a great recommendation to write down your questions and bring it with you. And I just wanted to echo what I was saying earlier about allocating responsibilities, that it's also good. One other tip you had, Carly, was to have a person who comes with you to your appointments. So whether you're a young adult or whether you're an adult in their 50s, it's a lot when you go to the doctor appointments sometimes to juggle all of the questions you had and what they may be telling you in the moment. So to have a designated person who comes with you as sort of your support, to have that list of questions and to be able to track and write down responses and things, is a really valuable tool as well. And then the other thing we had on our list to talk about was patient portals. Carly, do you want to touch on the role patient portals can play in your
Sure. Yeah, so I guess, back in the day before patient portals existed, You would have to call your doctor if you had any questions, and you were lucky if you're able to get to a nurse, much less the doctor. So, and it's still sometimes that way, right? So, that's where patient portals, I feel like, are so great because you can message your doctor, like, this is in real time. You can message your doctor. They may not respond right away, but they will respond, hopefully. They usually do. And I think that's just, it's so great to be able to do that. And then you also have all of your lab results and your screening results and your medical record online. Like, that's so important. I mean, there are some doctor's offices who use paper records and they haven't gotten with the times, right? So, um, to to be able to view your medical record, that's huge because you can always ask for a paper copy, but if you're in a doctor's office, and they said, oh, what were your lab results from that other provider that you saw? It's just like, well, let me pull it up, through the patient portal. So I find that it's really helpful, um, for if I need to contact my doctor about anything, if I have questions about anything. Again, building that relationship with your doctor, um, to view my results for anything that I underwent, from the past, or to be able to share with other providers. It just provides kind of that congruity that doctors' offices don't seem to have still, because not every for those who do use, like, an electronic medical record system, they don't use the same one as every other system in the country. So it kind of provides a divide between being able to share records amongst your doctors if they're using different systems. So, being able to have a patient portal, um, to be able to share other reports or results from another doctor with the doctor that you're seeing is pretty great. And there may be a lot of patient portals on your end because each EMR system has their own patient portal app or website, but it's so important, and I just think it's the coolest thing that we can do that on our phones in real time, and we don't have to sit on the phone and wait to talk to a nurse anymore. So definitely use them if they're available.
Exactly. And it's also a really good opportunity to take a step forward in your health literacy because one of the things we discussed is that sometimes when you get those MRIs or scans or whatever it is, you're trying to make sense of something without, if you see it, in your patient portal before you've had a chance to meet with your doctor, you're looking at it and you're like, what does all of this mean? So to meet with your doctor and have them explain it to you, and you even suggested, Carly, like having them label, like if you have a printed version or an editable version, having them label things so that you can take that with you as a resource to just learn and be more empowered. And maybe your next scan that you get and you're trying to interpret results on. So that was a great suggestion. So I think you had already covered our top 3 terms for health insurance. Is there any key takeaways for health insurance or health literacy? Like, what would be your closing thought with people when they're thinking about, okay, this is an area that I have some responsibility in, maybe I could improve in. Do you have any last thoughts?
Use I would say that, I mean, there are dictionaries on insurance websites, which are great for expanding your health insurance literacy, and there are on the NORD website, the National Organization of Rare Diseases. There's a whole dictionary on rare diseases, including this one. Um, And so I would find resources that will help you to expand your health literacy. And that includes when you're at your doctor's appointment, if you don't understand something, saying so and asking them to explain it in another way. Because there's no shame in that. And if your doctor refuses to do so, not that I don't think that they would, but if they say, I'm sorry, I'm not really able to do that, well, then it might be time to reassess your relationship with that provider. So asking for things to be explained in another way if you don't understand something, or ask them to like expand upon it if you are looking for more information. Looking at clinical trial websites such as clinicaltrials.gov. Um, that website can be complicated, but I know that they're trying to make it better. That can be very helpful because they have definitions of clinical trial terms, and again, just building that relationship with your doctor, making sure that you're comfortable to ask the questions that you need to ask, and yeah, just having that relationship with your doctor is so important. Making sure that they're taking care of what you need as a patient, not just your physical health, but your mental health and your emotional health too, because it's all encompassing, especially with a rare disease that's so hard to take care of on your own. And you're not alone ever, in your health literacy or otherwise. We're all learning one step at a time. It's healthcare, it's very complicated, but so needed. So we're all just trying to do this one step at a time.
Exactly. And I saw we had one question. We'll bring Amelia back in for questions in just a second, but there was one that came in that was very specific to, someone was asking if we could talk about medication and health insurance and what is covered and what is not. And that really varies so much from provider to provider. But there is a resource. It is called Patient Advocate Foundation, and they have sort of case managers. So similar to, this is maybe something Amelia does to help connect people to support in complex care. This organization has sort of case managers who will work with you specifically on this insurance process and understanding what's part of your insurance, and then making decisions about plans based on your needs and what's offered. So that's something that's really hard for Carly or I to answer in a general statement because it varies so much, but there are resources out there. And we'll be sure to post those resources along with Amelia's resources as a handout in this session afterwards. So, but Carly, thank you so much. I think that wraps up our time together. So we'll have Amelia come back and then have just a few questions that have come in. So hi, Amelia. The first question I'm going to ask is for you. So can you explain, do you work with palliative care units at all in your hospital? And how can palliative care be used as an additional resource with complex care? Do you ever work together with that department?
We work together with palliative and with hospice because unfortunately, many of the patients in our clinic just have very rare conditions that don't have a long lifespan to them. But we also have a clinic full of patients who have totally blown out of the water what the stats are as well too. But we actually, that's one of the hardest things is when it's time to actually talk to, people get very nervous when you talk about palliative care because if they actually think that just means, oh my gosh, they're giving up on my child, and they think it automatically means hospice is next and that sort of thing. But we actually have a really close relationship with our palliative docs. And sometimes they even come into our clinic visits and we meet with everybody together.
Yes. I was going to say, I think that's a really important myth to sort of bust, is that palliative care is not just for end of life. Palliative care is sort of similar to complex care and what you're saying, that it's a resource to help you manage all the many different components of support that a family may need. So if they don't have a complex care department at their hospital, maybe connecting with palliative care could be another avenue to pursue.
Yeah, and I know like a lot of hospitals, like if you go to their like at Cincinnati Children's Hospital, if you Google Cincinnati Children's Hospital palliative care, there's a really good video on there explaining what palliative care is. And I didn't even know about that until some of my families told me, because when the doctors bring that up, a lot of time it's just kind of like because it's next step and things to talk about, and then families who really don't understand it just get very, very upset and think, oh gosh, is there something going on that you're not telling me? So I don't love those conversations, like when social work isn't there to kind of buffer it and give a little bit more kind of like education there. But I'm in no way or shape form an expert in, palliative care or hospice. But those are hard conversations. But I love our palliative social workers and doctors, and we work extremely close with them, extremely close. Such a big part of what we do.
And Carly, there's a question about, do you know up to what age a child can stay on their parents' insurance? And do you have maybe any advice for a child or a teenager who's going through, because I believe the age, I don't know if it's 24 or 26, or Carly, if you happen to know off the top of your head, but do you have any advice for someone who's approaching that age of where they're going to be needing to select their own insurance? Are there certain steps they could take to prepare for that responsibility?
Sure. So it is 26. You can stay on your parents' health insurance until you're 26. That came apart as part of the action by the Obama administration. And so if you're looking to make the switch off of your parents' health insurance to, like, it really depends. Are you going through an employer sponsored insurance? Are you going through Obamacare? Are you gonna be? Do you need to be on Medicare or Medicaid for any reason? So it really depends. I would say if you're employed and you have and you're about to I'm not sure when open enrollment starts, but if you're employed, it depends on the company. But when open enrollment comes around, that means that your health insurance can be chosen, and usually your company will have a representative from that health insurance company to talk with. Sometimes they'll have webinars on what each of the health plans what they mean. So there's going to be terms like PPO, HMO, HSA, FSA. Those are all different healthcare terms that you'll have to learn. But there's always somebody from the insurance company who's willing to explain that. Or if you happen to go on the website of the health insurance that you're going to get, it'll explain it really well. They've done a good job of explaining the different terms. But then your parents are there too. I mean, they're on their health insurance. So, health insurance literacy, we're talking about that again. If your parents don't understand, call somebody from the insurance company and ask them to explain it to you, because that's your right to know as a patient what kind of insurance you're going to be getting in. And just as an overview, I guess, PPO means you are free to go to any doctor, and an HMO means that they will ask you to go to only specific doctors, or you'll have to pay extra. So, as a patient with a cancerous rare disease, PPO has been the best option for me because I'm able to see any doctor that I want without any consequences of paying more. So yeah, I would say that's my basic overview of what to do.
Thank you. Yeah, I think it's great. And it's sort of just the tip of the iceberg starting that process. But one thing you mentioned that I do want to reiterate is really important because I think there's a lot of hesitation from people to pursue Medicaid or Medicare. And a lot of people think they're ineligible, but there are different things like ABLE accounts or special needs trust. And we have a video about both of those webinars that I can link below. And what Amelia mentioned in her presentation, I heard her talk about waivers over and over again, is that those programs can qualify you for a lot of additional support that people really, if you're not enrolled in those and you can qualify, that you're missing out on, because the costs that could come along down the road are substantial. And a lot of times to qualify for those, you need to start sooner rather than later because there are waiting lists. I think you mentioned that, Amelia. So yeah, when you are looking at insurance, I would really encourage every single person in the FOP community to explore whether or not you can qualify for those government benefit programs, and be aware of how ABLE accounts or special needs trust could maybe play a role in helping you to qualify for those programs. So, but yes, this has been such a wonderful session on my end. I've really enjoyed connecting with both of you. And Carly, I have lots of different resources that you've created over time that I'll share with the community. And Amelia, I know you have that wonderful resource handout that I'm going to upload under the session. So and I didn't mention this, but I wanted to say that Amelia and Carly had never heard of FOP before I reached out to them. So they are people who just took the time to learn about our community, which I really appreciate, and to share your time and expertise with us. So thank you both so much for being here today. And I think that is going to wrap up our Q&A. So I